Well, the stigma that exists for those living with mental health illness affects many areas of our life. Our next guest is one of our country's most renowned experts on stigma and how it relates to mental health. Heather Stuart is a professor of public health sciences at Queen's and the first Bell Mental Health and Anti-Stigma Research Chair. She's joining us this morning from Kingston, Ontario. Good to have you with us.
Good morning.
There's been a lot of talk. We all know the benefits of speaking out about asking for help, yet it is this idea of stigma or fear of a negative consequence that stops people from reaching out to get the help that they know is there waiting for them. Take us through some of the ways that stigma affects people who live with mental health conditions.
Sure. Well, stigma, the essence of it is that you feel that you're going to be devalued. And if you feel like you're going to be devalued, you will try to hide the fact that you have an illness, so you won't talk to people about it. You'll think that you can handle it on your own. You'll try to, so you won't reach out. You will feel that you're going to be passed over in the workplace, so you won't maybe try for promotions. It really is pervasive, and it can affect every part of somebody's life.
People believe that these are actual and real consequences that will come to them if they reach out for help. You've been studying the effects of stigma for many years. You've also worked with the Bell Let's Talk campaign. How have things changed over the years when it comes to those attitudes and that fear of what could lie on the other side of getting help I need?
Well, we've seen a lot of changes with the Bell Let's Talk campaign. You can see the numbers going up every year. We know that awareness is increasing. People are more likely to talk about illnesses. Attitudes are softening, but we still have a long way to go. We want people to feel more comfortable interacting, coming forward, not fearing that they're going to be somehow devalued if they say that they have a mental illness, and just to feel more comfortable getting the support and the help that they need.
What areas would you like to see us focus more on when it comes to combating stigma around mental health and mental illness? Where do you see the gaps?
Well, I think as organizations, we could do a lot more. So we could think about getting at the structural pieces of stigma. We could implement training programs, for example, so that everybody who has something to do with people, who is a supervisor, a people leader, knows how to have a conversation with somebody, how to open that conversation. We could do this in high schools. We could change the curriculum for professional folks so that they know more about mental health and mental illness and the effects of stigma. So I see that our next real challenge is looking at organizational behaviors and getting at the structural pieces.
Aside from organizational structures or research, someone like yourself has been doing for many years, what can the average person do to help encourage someone that help is something that they should reach out for, and that stigma is something that exists in here but not necessarily in reality?
So people should realize that those who have mental illness will self-stigmatize. So they'll feel that they're somehow to blame or ashamed. And I think the thing that we can do is learn how to have a conversation with somebody. If we're concerned about them, if they haven't been themselves, how to reach out and provide that kind of support and be there to listen and support them and to help them in their decisions about what they're going to do about their illness, whether they're going to seek support, go to a doctor, seek other kinds of support. I think having that conversation is very important.
Great advice. Heather, thanks for joining us today.
You're welcome. Thank you.
All right, don't forget, today Bell will donate 5 cents for every text message and mobile and long-distance call made by Bell Canada, Bell Alliant, and Bell MTS customers, and every tweet that uses the Bell Let's Talk hashtag and view of the Bell Let's Talk Day video.